Hi everyone, I'm Dr. Santoshi, consultant dermatologist at Aesthetica Veda, Whitefield, Bangalore. So today I'll be talking about skin picking disorder, also known as dermatillomania. It's also known as skin excoriation disorder. So it's basically characterized by repetitive picking at one's own skin to the point that it damages it, and it is associated with stigma, shame, low self-esteem, and it can be secondary to a primary skin condition like usually seen in people with acne, but more often than not it underlies issues like obsessive compulsive disorder, anxiety, depression, etc. So it's a vicious loop. So people, when not all people, sometimes when they're stressed or feeling a lot of low self-esteem or shame or stigma, they end up picking on their skin compulsively to kind of wear down on the anxiety and boredom, etc. Now what this does is, it's for the temporary period of time there'll be a reduction in the anxiety, so there's a positive reinforcement. So people turn to skin picking as a form of self-soothing almost. What this results in? Skin damage. So again, further dip in the self-esteem. So it's a vicious cycle and one that requires a little bit of help from a professional to get rid of. First, the role of a dermatologist in identifying this disorder is people have to be actively questioned that have they tried to stop picking at their skin, and has it affected their psychosocial functioning? Has it caused them to withdraw from social activities, from romantic life, partners, etc. So all these questions will give us a clue if whether there's an underlying disorder or if the patient is just picking at the skin now and then and it's not causing them significant psychosocial disturbance. So that said, the therapy of course first starts from here, because there's a lot of things that goes on here that results in this patient picking at their own skin. So first, there's something called habit reversal therapy, habit reversal training, where the patient is taught to first become aware that they're picking at the skin, how often they pick at the skin, identify the triggers that result in them picking at the skin, and there are ways to combat that as well. First is generalized stress reduction, okay, and second thing is when they feel the urge to pick at the skin, they should be taught an alternative activity that they can focus on that will make it hard for them to pick at the skin. For example, whenever they feel the urge to pick at the skin, they can sit on their hands, put their hands under their thighs and maintain that position while focusing on their breath till the urge passes or till they get occupied with something else. So these are ways that they can prevent themselves from picking at their skin and causing more damage. This, apart from there are medications like selective serotonin reuptake inhibitors, N-acetylcysteine, these are adjuvants. But of course the role of the dermatologist is to identify the underlying psychosocial morbidity so the patient can be treated with the best available therapies, so they can go home with a smiling face and so that they don't experience a further dip in their self-esteem. So it requires holistic management and requires a lot of awareness both on the practitioner side and also on the patient side, and a commitment from both the patient and the doctor that they want to get rid of this disorder. So yes.